So I really want to put that report in context. And this is essentially an outbreak in Provincetown among vaccinated people of symptomatic breakthroughs that were almost all mild. So I want us to remember the message of this outbreak. I think it's important to still say that the vaccines work, and we should not be saying the vaccines don't work. Out of over 800 people who got exposed to SARS-CoV-2, there were 3 hospitalizations, there were no deaths. This is an amazingly effective vaccine at preventing severe disease, hospitalizations, and deaths. That was actually the promise of the vaccines. It was always why we designed the vaccines. Otherwise, there would not have been a design of a vaccine against something that did not cause severe disease. The second thing that we learned from this outbreak is that the Delta variant is very transmissible and that it has high viral loads. And what that will do is that it can lead an vaccinated person, even before their B cells, what are we called memory B cells, produce the antibodies that get into their nose to stop that infection, that can cause more mild symptomatic breakthroughs. And because of that, the CDC's recommendation in areas of high circulating virus to wear masks indoors, even for the vaccinated, is very reasonable. But the third thing from that report that is very important is we cannot conclude that vaccinated people are equally as likely to transmit as unvaccinated people. This was based on what are called cycle threshold tests of PCR values, but they have not done culture tests. They have not done serial viral loads. Presumably what's going to happen is a vaccinated person is going to fight that virus, bring it down in their nose. So any conclusion from this that vaccinated people are equally as contagious should not be made. Let's look at the 3 places that are notable with this variant. First was India. Very sadly, very terribly, at 3.7 vaccination rate in early March, there was no way India could withstand the terrible effects of the Delta variant. It is extremely transmissible, as we just indicated, and there were low rates of immunity in the population with such low vaccination rates by the time the Delta variant hit in early March in India. Thus, you saw a terrible, terrible wave of severe disease, and that was a terrible way to get through the Delta variant. The way to get through the Delta variant is vaccination. And so then what we saw in the UK with higher rates of vaccination is that the Delta variant caused many more cases, but they had higher rates of vaccination than most places in this country. And so the hospitalizations stayed relatively low. We are a mixed country. There are areas like Vermont, like Virginia, like the Bay Area that have higher rates of vaccination. You can see the hospitalization staying controlled. But there are many places, Arkansas, Mississippi, Louisiana, Texas, Nevada, where have lower rates of vaccination, and you're seeing the hospitalizations go up. The only way to get through this terrible virus is higher rates of vaccination. So one is, of course, community-based messaging. In fact, this has been the success of the vaccination campaigns in Latinx populations in San Francisco, and there have been higher vaccination rates in Latinx communities in San Francisco because of that work. Second strategy, bringing vaccines to where people are, in their pharmacies, in their doctor's offices, at their workplaces, and giving them time off to get that vaccine. If they don't feel well after the second dose, giving paid time off to get the vaccine and also paid time off after the vaccine. Third strategy, free transportation and childcare. Fourth strategy is vaccine passports. Vaccine passports means that we didn't want to use this P word before, but it is important in our country to say, you can't come in this restaurant if you're not vaccinated. These sorts of passports, these sorts of incentives, that if you want to be in an indoor space, that vaccine passports really worked. And the last one, and I really need to discuss the history with you, is vaccine mandates. This is a public health issue. There is a Supreme Court ruling in the United States that it is legal and ethical to mandate vaccines for public health crises. You are now seeing the effects of that ruling. You are seeing that state employees in California are being asked to vaccinate or have repeat testing. Public-facing employees are mandated to be vaccinated in San Francisco and New York City. and in Santa Clara and increasing cities around the country. Number 4 is that we are mandating vaccinations for healthcare workers in most settings. And that is any healthcare worker should be vaccinated against this virus. So you are seeing the dialogue shift to phrases of vaccine passports and vaccine requirements in the context of global vaccine inequity. So many places in this world, we are leaving vaccines unused. We are leaving vaccines on the shelf, and you are going to see the dialogue shift towards vaccine mandates. I will tell you that it is likely that any mandate will come with 3 exceptions. Those 3 exceptions will be natural immunity. Second is religious. And third is medical. So if someone really doesn't want to get the vaccine and they have a medical reason, or they are more concerned about side effects, there are always exceptions to be made to mandates. But as you can see, not having high rates of vaccination in so many places in this country are leading to the prolongation of a pandemic.